Let's hear from our experts on how we could promote brain. Before we move on to our main topic, I would like to give you a brief on BioVikas, a registered trust with the dream to build and strengthen an ecosystem for senior citizens that empowers the seniors to lead a productive and meaningful citizen members enabled through an online platform with the focus with legal, financial, health. I would
Pavitra, your voice is cracking a lot. Your voice is not clear at all. It's cracking a lot.
Yeah. Okay, just give me a minute. In that case, let me switch over my internet connection. Just a second. Is this better? Are you able to hear me better?
Yes.
Okay. Sorry. Moving on. I just want to remind, in case you didn't get it, I just want to remind people to please keep yourselves on mute and ask your questions in the text box. We will come back to the questions as the session progresses. And if and when we don't, we'll always keep, it might not be in the same order as asking your questions, but we'll try to keep it going smoothly. Without further delay, I would like to introduce two of our speakers for the session today. We have Dr. Prem Narasimhan and Mr. Shailesh Mishra. Dr. Prem Narasimhan, he is an MD in geriatric medicine and he is a chief consultant geriatric medicine medical doctor at Jeslock Hospital. Training in geriatric okay, let me just see what's the issue is.
Ma'am, if I may come in, I think you can ask everyone to switch off their video so that the bandwidth will get increased and you will be clear. So I think we can request everyone to switch off their video. Only your video and the two doctors and the other person, their videos can be on. Everybody else can switch off their videos. It will help.
Yeah, I'm switching net connection.
Pavitra Madam, as a host,
I hope this is better.
Pavitra Madam, as a host, you can switch off everybody's video. So I think you can do that and keep only Mr. Shailesh and the doctor's video on. You can do that. You can have the control. Thank you.
Yes, sir. Thank you. We will do that. Is my voice clearer now? We'll just switch the internet connection again. I hope this works better. So I'd like to introduce both of our speakers for today, Dr. Prem Narasimhan and Mr. Shailesh Mishra. Dr. Prem Narasimhan is the MD Geriatric Medicine, Chief Consultant Geriatric Medicine at Jeslock Hospital. He is also the Chief Consultant at Graceful Living. His areas of interest are geriatrics, dementia, urinary incontinence, orthogeriatrics, community geriatrics, and preoperative care of the elderly. Training in geriatrics, geriatric oncology. He also holds a membership Indian Academy of Geriatrics, British Geriatric Society, and American Geriatric Society. Prior to Jeslock Hospital, he was the Assistant Professor, Department of Geriatric Medicine in All India Institute of Medical Sciences. He is extensively involved in telemedicine for older adults for both COVID and non-COVID cases, and conducts support groups for older adults as part of Graceful Living. Thank you, Dr. Prem, for joining us today. The other speaker is Mr. Shailesh. The other speaker is Mr. Shailesh Mishra, BA Economics graduate, born and brought up in Mumbai, in a small town near Mumbai called Palghar. He is a social entrepreneur and a mentor. He is the founder of Silver Innings Group, a community dedicated to senior citizens in India. Mr. Shailesh Mishra is a renowned international social activist working for the welfare of senior citizens. He has around 15 years hardcore marketing experience in corporate world, and since last 12 years actively involved working with the elderly. His organization Silver Innings, which was established in April 2008, is working towards creating elder-friendly world where aging becomes a positive and rewarding experience. He has won several awards, including National Award Karamveer Puraskar in 2008, Karamveer Jyoti in 2016, and he was also conferred Meera Bhayandar Ratna by Rotary Club for the extraordinary work with senior citizens and dementia. He is considered a friend among the senior citizens and a mentor and guide to youngsters. He is very passionate about photography, music, and football. Welcome, Mr. Shailesh. We'll start off the session. We'll start off the session with a brief talk by both of them, and then we'll open it up to Q&A. I would invite Dr. Prem to start. Dr. Prem? So your video seems to be frozen. I think we are having a lot of connectivity issues today. Is it raining in Mumbai?
Yes, very heavy.
Okay. I think we'll wait for Dr. Prem to rejoin for a second. If it takes longer, we will start with Mr. Shailesh.
I suggest you please ask everybody to switch off the video.
Yeah, could you please do that? I think most of them have.
Should I start?
Yeah, I think we'll start with you, sir.
Okay, so we'll wait for Mr. Prem. Good evening and good afternoon, everybody. And thanks for the opportunity to speaking with regard to Alzheimer's on World Alzheimer's Month. We are doing this program to mark the World Alzheimer's Month. That is September every year. It's celebrated or marked. In 2012. United Nations marked this day or month as World Alzheimer's Month, and 21st September every year is celebrated as Alzheimer's Day. So this campaign is done all over the world, all the cities, towns, wherever possible, to create awareness about Alzheimer's and dementia, and talk about stigma surrounding against for dementia, and also what can be done from the civil society, from the government, and what we should do for the family members. So this is the area where we all work, and that's why we are doing this session. Mr. Prem is here. I think Dr. Prem will be able to tell you more about the medical side of it, and I'll speak about psychosocial care. Thank you.
Yeah, Dr. Prem. Dr. Prem, you can introduce and start the topic.
Yes.
You're on mute, sir.
To be very frank, it's a bad internet day today. So I also lost you, so I really don't know what happened. So I think Mr. Shailesh Mishra was talking about World Alzheimer's Day and the about WHO. So if you could just ask me whatever you want me to answer.
No,
Because
would you like
I really
to
didn't.
introduce the No, he didn't speak much. He was just waiting for you to join us. Would you like to start the whole session, and then I'll ask Mr. Shailesh to come in?
Yeah, so I think, the quote which really stands always is, I think it's the definition of health itself. I think health is a state of physical, mental, and social well-being, and that I think applies to almost everything for any age, and I think it applies even more so for older adults. Now, the reason being, almost all the three domains are sort of involved in cognitive impairment, and then, of course, ultimately in a person getting into dementia. Now, the thing with dementia is we always keep concentrating on the Alzheimer's word because you can say it's talked about more. But dementia itself is an umbrella term, and there are a lot of causes of dementia, and there are a lot of reversible causes of dementia as well. So I think to sort of delve into that, I think hypothyroidism and vitamin B12 deficiency, then even folic acid deficiency, then to a great extent there is something known as subdural hematoma, in which an older adult might fall and they might have some accumulation of blood in the brain, and if you drain the blood off, then they obviously sort of improve the dementia part also. Then there is something obviously known as NPH, which is normal pressure hydrocephalus. Again, that is because what happens in the brain is the size of the certain parts, they increase and the pressure sort of increases. So there is a problem in walking, and there is a problem in even there is urinary problems, that is loss of control of urine, and ultimately dementia as well. So, but the problem usually is we tend to forget about another common thing which is missed. That is also depression. So I think depression is known as pseudo-dementia, and a person who is depressed might behave as if he's actually having cognitive problems, but it is the fact that whenever we ask questions to them, it's just that they don't sort of respond in the way we want, because they're just not interested in the questions. Now, of course, there are causes which are irreversible. So one has to understand that we obviously, when changes happen in the brain, unfortunately, the neurons do not regenerate, but there is a concept of neuroplasticity in which connections between the various nerves or synapses can be sort of kept. And that is what we try to work on even in a person with dementia. So the neuroplasticity should continue. And the irreversible causes, of course, there are Alzheimer's disease, which is most commonly sort of talked about. There is something known as dementia with Lewy bodies, which can be very difficult to handle because there can be a lot of behavioral issues. And then, of course, frontotemporal dementia, which is again, there is a lot of movement disorders. There can be hallucinations, especially visual hallucinations. And ultimately encompassing that would be, there could also be vascular dementia, and maybe a lot of people might have mixed dementia. So this overall is sort of the types of dementia, but one has to understand that just because somebody is having memory loss does not mean that he or she actually has dementia. So the difference between obviously normal aging and a person who actually has dementia is something which is very important, and which obviously I will sort of dwell onto in some time as well as we move ahead. You're on mute, Pallav.
Thank you, Dr. Priya.
Yeah.
Mr. Shailesh, would you like to continue?
Yes, Dr. Prem, as a doctor, he will speak, and he's speaking about the clinical side of it. But yes, this is a problem which we feel practicing in this area for last 16 years, that most of the family members and adult seniors are in denial. They don't accept that they are suffering this some kind of mental illness or dementia, Alzheimer's, because we always talk about physical health, because about obesity, the blood pressure, and other things which is already known. But dementia, Alzheimer's is something in the brain we don't accept. It is a progressive brain disorder, which not only impact the memory. I think memory loss can be accepted and can be dealt with, but behavior changes in the problem. I think that is the more issue where you can't do your activity of daily living, you can't perform take decision on money, health, your day-to-day task about shaving, taking bath, having medicine, having food, dressing. You tend to lose the control of this all things. And I also believe the dementia, Alzheimer. When we talk about dementia, Alzheimer, when we people get diagnosed, there's a panic. There's a kind of shock. Oh, what is this? And no, I'm not suffering, because mental illness has a big stigma and nobody wants to discuss it. This is a doctor also will accept that, and people don't come back again, after the diagnosis. But we have to remember, we are dealing with cancer, we are dealing with HIV, we are dealing with diabetes, blood pressure. This is so common, and there is not only cure but treatment also. There are some cases cancer and HIV can be cured. Diabetes and blood pressure, you're taking medicine for your life now. Here also it will have same thing. It has to be, people are not trained how to take care of their loved one, or I'm not trained to take care of myself when I'm suffering with dementia Alzheimer. I think that is a problem. So once the diagnosis, when the doctor says you have dementia Alzheimer, I think there things will come where we need to train the person. I think if you train the person, will be solved. And one thing also remember, it was noticed or discovered in 1906. Today we are in 2022. Still, most of the dementia don't have cure. We have developed vaccine for corona in only 2 years, but still dementia Alzheimer more than 100 years, nothing has happened actually. There are some medicine, of course, we do treatment. So it is kind of urgency step for the government and the civil society, for the pharma company to do something about it.
Thank you both for the brief introduction about dementia and Alzheimer's. I would request people who have questions to put it in the messages so that we can answer them. But I would like to start off with asking a very basic question, Dr. Prem, maybe to you first, about how do you identify the signs of dementia? How do you know? I mean, people tend to say, okay, I'm forgetting as I'm aging. So how is that different from actually having dementia? How does a family member identify it?
Okay, so I think the easy way sort of to tackle that will be, there are obviously certain signs which we need to look into. But if you purely see what is normal aging and what is Alzheimer's, I think normal aging is, everybody, one of us, as to be very frank, Mr. Shailesh Mishra also said that ultimately it's not about memory. So our obsession with dementia and memory is a lot. But the brain does not function only on memory. The brain functions on a lot of other things like judgment, decision making. So when normal aging comes, once in a while we obviously will end up making bad decisions, making decisions in which our judgment is wrong. But in dementia, the poor judgments and decisions will be there in a lot of time. So that will be sort of really frequent. Then in normal aging, somebody might miss maybe a monthly payment, maybe a rental, maybe a bill. But in case of a person with full-blown dementia, there will be real problems taking care of monthly bills. Nothing will be on time. There will be a mess. There are extensions really on dates, but the person is not realizing. Then usually in normal aging, we might think that, okay, what day is it? What date it is? We might just keep a bit of time to sort of figure it out. But in case of dementia, it doesn't really come back. So losing track of time, date, maybe 2 years older, people might be still thinking that they are in their past. They actually end up thinking that it's their son. It's their father instead of the son. So such things can happen. Now, a lot of times we normal aging might tend to lose the word for speaking. We want to utter something, but we don't get it, but it comes to us. But in case of in a full-blown dementia, there will be a real trouble even actually having a proper conversation. To actually, there will be a lot of repeatability. The person will not be able to sort of maybe concur what's actually happening. Then losing things from time to time. So we very normally, even at a younger age, we might misplace things. But in case of a person who's aging normally, there are. But you tend to, okay, fine, I kept such a thing here. And it comes back to them. But in case of dementia, misplacing things and not even knowing that actually that they have actually misplaced things, that can happen a lot. Then as severe dementia obviously comes in, then there might be wandering, directions is an issue. A person, familiar places also, an older adult might actually forget, as compared to a lot of times we might actually forget maybe a landmark, but we do come back to it. But in case of dementia, it becomes very difficult. So I would say, just to highlight when you should actually sort of see that these might be the red flag signs. So for example, if somebody is asking the same questions again and again, getting lost in places which are very well known, having trouble with maybe recipes and things that they actually do very, very much normally, which is a very normal schedule for them, then becoming more confused with time, meeting places, even sort of meeting people. And ultimately, our sort of challenge really happens with, even Mr. Mishra will substantiate, is when caregiving will come and he'll talk about it, is that when the person has got cognitive impairment, but the activities like bathing, eating, dressing, all these things are still intact, we are still okay with it because it's minimum cognitive impairment, MCI. But once the dementia tends to worsen, then the quality of life gets affected and these activities are affected. So that is when the caregiver burden, obviously the caregiver who's taking care or the person who needs to take care of the person, it might be actually quite difficult. Now, one of the very important lines which I would want to say is dementia is very much not a part of aging. So let us make it very, very clear. Dementia is a pathological process. It is a disease. You cannot put generalized myths to dementia, like all older people will get dementia and all older adults will have forgetfulness. Not necessarily. And one of the very important things one has to understand is, apart from memory, like a person might look at their own image in the mirror and might not be able to recognize that person. So that also happens as frequently, as the sort of the dementia gets worsened. So when such changes tend to take place, the caregiver or the caretaker should be very, very sort of careful in understanding. And then, of course, the doctor obviously should be involved. In general, always, even if you have a little forgetfulness, I would always say that it's better to get your screening of memory testing done. The earlier, the better. Maximum, you will not find anything and you will only do things to preserve your memory. So, of course, we'll come to that as well. But broadly, these are the things which one has to understand. Don't put everything to aging, but at the same time, understand what is actually a problem and what is something which might not necessarily be pertaining to cognitive impairment or dementia.
Thank you, Dr. Prem. Mr. Shailesh, this is from the same but a different angle. How do you think caregivers of a person need to be aware of about dementia? What do you think they should be looking for in terms of signs of aging, especially when they're taking care of an elder at home?
Okay, let me first also go back again and tell you all, and what Mr. Prem is talking about, that India is fastest growing senior citizen population. It's going to take over China. We are going to be largest senior citizen population. And it is estimated around 4.5% of senior citizens in India. That is more than 125 crore senior citizens, 60 plus. Out of that, 4.5% might suffer or suffering with some kind of dementia and Alzheimer's. That is around 55 lakhs of people who are suffering with some form of dementia. So I'm just telling you some background about it. And also, as Dr. Prem said, this is also not every person will be having dementia, Alzheimer's. There are a lot of causes. Dr. Prem will discuss on it. But one thing I strongly believe and I talk about is whole dementia, Alzheimer, the aging is it's a life cycle approach. Dementia is not going to happen to me when I'm 60 or 70. It's about how we have lived our life from mother's womb to the tomb, the whole journey. It's about the journey, how we are aging. From single day on mother's stomach, we are aging. So we are 1 year old, 2 year old, and 10 and 15, 20, and then we grow old, very old. So what we ate, what kind of illness we are born with, in middle age, what kind of disease we got, diabetes, kind of blood pressure or vascular diseases or thyroid. So there will be some causes, some things that will happen to us when we grow old. Also about lifestyle. So how much we are sleeping, how much we are spending time on ourselves, how irritated we are as a person, how angry we are, how happy people we are. So disease will follow you as per your character, as per your kind of things you're born with. I think this is also one important thing to remember. And Alzheimer and dementia doesn't happen to only Indians or Western people, or it's a Western concept. No, it was there always in India. It was always there everywhere. But because of joint family system, we never came to know because everybody was taken care. Example, I had a 100-member family. We had somebody who was disabled, who was a widow, there are 38 children. My grandfather, I remember now, he was suffering with Alzheimer. We never knew because we always so nice with taking care of each other. So because we are staying in small flats, because we're staying in small rooms in this metro cities, the disease has come out because there is nobody at home to take care. And then there's a stress on the caregiver, the family members who are going to take care. Earlier, they were a husband and wife who were taking care of mother and father, but now both are working. So there is nobody at home who is going to, take care of the children or old people. So there are so many things. Other thing is, as I said earlier, it can happen to anybody. It doesn't see social, economical, your cultural, ethnic, geographical background. It can happen to anybody. In fact, there's a estimate that every 7% might be suffering with dementia Alzheimer's. So it happens every minute. So we have to be careful. So the disease starts not only at 60 but at 30, 40 years of age. The process starts at that age. Dr. Pei will agree, and then actually shows the symptoms sign when you're 60 or 70 plus. And mostly it happens to 60 plus people, but now there are trend of early onset 45, 50 plus also. But you don't have to worry if you have memory loss. Just go and check with the doctor. Every memory loss is not dementia Alzheimer's. I think that we have to be very sure about that. And don't label anybody dementic. We are using the word very loosely for political people, for interviews, everywhere. Oh, he's a dementic person. It's not so. We can't call. So there can be a delirium. There can be excess alcohol. There are so many reasons for dementia Alzheimer's. And one more thing for all the viewers, when we are talking here, when we talk about some medical terms, don't take it, don't follow that. You have to go to your doctor and take the medicine accordingly. We will be speaking some medical thing also here, but this is just for knowledge, information. Every individual is different. Impact of dementia and Alzheimer on every individual will be different. It is not a generalized thing.
Thank you so much. I think it's very true that we tend to loosely use the term and use it as more as a derogatory term that at times saying that you're demented or something rather than understanding the seriousness of the issue. So there are a couple of questions I would like to start off. One of that is, does taking B12, folic acid, etc. or vitamins help with prevention of dementia? So you're on mute, Dr. Prem, you're on mute.
So basically, vitamin B12 and folic acid, if there is deficiency, then definitely. I am a firm believer of not taking multivitamins just for the sake of it. The reason we need to still supplement is not a lot of older people can get that food and get that sort of, you can say, the stores that the body needs through the diet. They might have challenges with teeth, they might have challenges with digestion. So then in that case, supplementation always helps. But to just generalize and say forever we can take multivitamins to sort of replenish the stores is a bit difficult. And secondly, I have seen a lot of older people just taking 3-4 types of vitamins having the same content. So that also doesn't really help. In fact, the drug burden only sort of worsens things in older people. So I would say try to get maximum from the diet. But yes, vitamin B12 and folic acid, if it is less, then you obviously can supplement it. And in a lot of people, a lot of older adults, if they're not able to take orally and it's very low, then sometimes we have to give injections as well, just to sort of replenish for that particular time. But a maintenance through the diet is always essential, because ultimately there is what is the name? They are known as supplements. They are not known as the main diet. So the reason they are known as supplements is they are supposed to supplement your main diet and not be the only diet. Because a lot of older people just keep telling me I eat more medicines than food. And that is, as a geriatrician, I don't want that ever. I want them to eat more food and less medicines to the maximum possible sort of effect, because a lot of older people might have a lot of diseases. So medicines can add.
Yeah, thank you so much. There's another question. I think this both of you can take. This says, apart from predisposition towards mental illness like dementia or Alzheimer's, are there any preventive steps that one can take, say even at the age of 70 or later?
I think we can come to that later. Let's talk about the disease prevention. We can talk. Of course, we have to talk. But I think let me also tell you, if Dr. Prem permits, so I can talk about some causes which we believe is the reason we can avoid dementia and Alzheimer's, or why it happens. One thing is, I think family history is not very much high, but 5% having family history of this some mental illness and dementia, Alzheimer's. That is one cause. Stroke, blood pressure, diabetes, thyroid are some of the causes of dementia, Alzheimer's. Excessive smoking, drinking, alcohol. These are some of the causes, and of course, we have deficiency of vitamin B12 and other things. So, because you have vitamin B12 deficiency, you go and pop the pill. When you know that you have some memory problem, you're forgetting, you're making mistake. Memory loss is not just loss. We just discussed, it's a behavior change. Example, I forget counting, I forget signing, I make mistake. I make mistake in dates. I don't remember things. I see people every day, but still, it might be because of stress also. It might be because of depression. It might be because of some medical problem. So, but if you have something, go to the doctor and ask the doctor to the problem. He will diagnose you, and he will then refer you to a psychologist or geriatrician like Dr. K. Because there's a process. You just can't, and every general physician, this sad part of the country, doesn't know about dementia Alzheimer's actually. So, sometimes my mother is not sleeping. The doctor will say, okay, take the sleep. Oh, she is very old. What's the need, Just give a sleeping pill. So sometimes it doesn't make misdiagnosis. But I think biggest cause, Dr. Prem will also dementia Alzheimer's is socially inactiveness. The country, we are still in that British era, retiring ourselves after 60. You are 60 plus, you are senior citizen, you're good for nothing. Now, many people have this habit, this is a mindset. So, 60 ho gaya, now I don't have to do anything. I'll just take rest. I'll go do puja, I'll read newspaper, I'm retired. No. You're retired from your work. You're going to live longer, 90, 80, 90, 100 years because of good medical health, good lifestyle. So, you can't be socially inactive. Dementia will set into 50% people who are socially inactive. You have to keep yourself busy. Not only doing unwanted things, but kind of doing social work, doing some brain games, learning some new things. It can be language, it can be music, it can be creative art. There's so much. The social inactiveness also lead to dementia Alzheimer's. I think this is one of the thing I wanted to tell you. Modern lifestyle, because I think today's younger generation are more prone, maybe because we have seen people only about one kind of job, but sleeping deprivation, insomnia is also one of the reasons. So how much you sleep, how much you don't sleep. There are some, but I think causes is also important. They talk about the prevention. So let's first talk about this. And let me also tell you, There might be no cure, but there are some reversible parts and there are treatment available. There can be pharmacological approach, there can be non-pharmacological approach or advanced state. We don't get people in the first stage because we deny that we are suffering from go to doctor very late because mental health takes backseat. We also talk about physical kind of things. I'm looking good, my hair is gone, I have eyesight problem, I have hearing problem, but mental health nobody talks about. I think here we have to pay attention if you really want to prevent or take yourself away from dementia Alzheimer's.
Thank you. I think the next couple of questions are already answered because it's how can we keep a brain in good health and keep memory good? How does coloring mandalas help? How do I handle lack of focus and distraction? I think this is more on how do you keep yourself mentally active to prevent dementia. Dr. Prem?
Yeah, I think I would just want to address what one should do when you actually have forgetfulness, because it's all about, it's not that every forgetfulness is going to be causing that severe cognitive impairment or dementia, but you need to up your game. You need to up your game to make sure that you don't get more forgetful. So how do you do that? And some of the things, of course, Mr. Shailesh has mentioned, but let me just put it into a pragmatic way. See, it's very easy to say that we have done everything in life, but you haven't. So once you retire doesn't mean that you stop learning. So learning is one of the very important things. Your brain gets so bored. The brain is the organ which gets bored very easily. So you have to keep challenging it. So maybe learning a new skill always helps. It could be a new language. It could be gardening is very well proven. Pet therapy is proven. Music is also something which is really good. Then apart from learning a new skill, one can obviously follow a daily routine as well. Now, once you must have been following, a lot of people follow a routine before because they are working, but after that they tend to just lose it out. Now, following a routine which will help you out in spite of whatever diseases you might have. I mean, it should be a routine which you will be able to follow. It should not be a routine which is a strict regimen which you will not follow, because having a routine and not following it is not going to help you. Then always plan tasks. You can plan tasks. Now, make a to-do list. And these are things which everybody has done throughout their lifetime. It's not that they don't. It's just that we tend to think that we cannot recalibrate it. So you can recalibrate. Have a to-do list. Write it down in your diary. Then also have a to-do list on maybe a blackboard or maybe a whiteboard. And then also have technology helping you to give you reminders. So there are 2 or 3 ways. So you will not forget, and ultimately you will keep remembering it. Then another thing which one should do is make sure that you are at least able to put your things of daily use in the same place every day. Whether it's your glasses, whether it's your watch, whether it's your keys. So there is some kind of organization in which you can actually do it. Then stay involved in the activities which not only stimulate your mind but also your body. So I think physical exercise always helps in all disease processes, and it also helps in the mind. Then of course you can volunteer. It's always good. I mean, we have been volunteering in a lot of ways. I think one of the great things that we actually saw even during the pandemic was we saw that people could really rise up to it. So we saw a lot of older people do it. We saw a lot of elder care associations do it. So everybody sort of volunteered a lot and not thinking about the disease because they wanted to do a lot. And that also helps. It is said that to have a purpose in life only sort of improves your way to not forget doing things. Then, of course, spending time with your friends, with your family. I think sleep is very important. The relation between sleep and dementia is only getting more and more connected. The lesser you sleep as you're younger, the more worse you might actually have memory issues as you go older. Your brain dysfunction might be more because, let me just quote a very simple thing. When we used to actually go to, when we were in children and we had exams the next day, our grandparents used to tell us that we used to sleep early and we should not keep reading late so that we can get up and be fresh. It's not because we can get up and be fresh for the exam, but whatever we have read, the memory is reorganized. Building blocks are made in the sleep. So if you don't sleep, you are not actually, you have learned things, but it might not become more of a permanent memory, especially for life or for particular that. Then, of course, alcohol is a big downer. Smoking also is a downer. Then there is nothing as taking care of your health. You have to take care of your health. Be active mentally, socially, and physically, all the three. Nothing, one deficiency in either of them affects the other. We saw the social deficiency to a maximum extent in these pandemic where people were not able to have social engagement. However, I have to give kudos to older adults. They overcome that also, and now you can see we are not talking in person, we are online. So their technology has been embraced by them, whether they were in technology before the pandemic or not. Because I know personally a lot of older people who were not even having phones which are sort of touchscreen. And now they know more features than maybe even me. So that's why when you give older adults a task, they do it in a very organized way. So that also helps in the brain. It also helps in making you more and more sort of helpful. Then another thing you should never sort of neglect is if you feel depressed as well, because feeling depressed has a very much negative impact in life. Reducing stress is very important for sort of a preventive measure. It could be anything. Do meditation, do music, whatever cools your mind down, because the more the stress in life, it could be anything. And look at your own life as a particular, you can say, motivation for you. I'm sure everybody has undergone a lot of obstacles, milestones, good ones, bad ones, but ultimately overcame all that. So that should also help you. Reminiscing also helps a lot as far as memory is concerned. The good times, gratitude, sense of gratitude, writing a diary also helps in your mental health, and at the same time, it also helps in making you more and more active. So remember, it's all about practicing. When we were kids, we used to practice 2 2s are 2, 2 2s are 4, 2 2s are 4, 2 3s are 6, and continuously. But that became the back of our hand. So when we get older, we still need to retrain our brain. And once we do that, we will be able to overcome the forgetfulness, and also the memory aids, whatever that might be, are also very helpful. I mean, I'm not saying all of us would have seen Ghajini. Of course, it took it to a total extreme, but they were all memory cues. What you need to take away from that movie is they were all memory cues in which it was written that this is where the keys are, this is where the photograph is, this is where. Of course, I mean, I'm not saying somebody who keeps forgetting. I mean, a dementia patient is worse than the Ghajini kind of a patient because there is no connection whatsoever. But when we see memory loss happening initially and there is forgetfulness, there is still plenty to work on. And I think prevention is better than cure is a very good way. But in older adults, it is also care along with cure. So I think that is something which has to be dwelled into. And that is something which all older adults and their caregivers should understand, that sometimes you might not be able to cure the disease, but that does not mean you cannot care or arrest the worsening of it.
That's very true. Yes, Dr. Shailesh.
Dr. Prem. Dr. Prem, I want you to tell the audience how you diagnose somebody has dementia. What are things like, is it the MRI? What are the things doctor will do? What kind of test to tell the person that you are on dementia? If we can highlight that, then I'll take ahead.
Yeah, so usually, of course, depending upon what the symptoms they present with, we do some scales. So there are leading questions which are obviously asked, which can be about the orientation of time, place. It also helps us to know about whether they have good proficiency in language, whether they are able to remember calculation, very simple tasks, whether they are able to draw things. So there are scales in which we do, and then we are able to sort of assess whether there is a memory problem or there is a brain health problem at all. That is, of course, the first thing. Apart from that, we might already have history, whether they have diabetes, whether they have hypertension, whether they have risk factors for that particular dementia, whether there has been a history of repeated falls, and we might have to suspect, yes, there might be a chronic subdural hematoma in the brain, which is the one which is actually causing. Again, there is no rule which says that dementia and depression cannot be together. That is also there together. A person who is having mild cognitive impairment can have depression too. So it becomes very difficult to differentiate them, but it can occur together. So once that is done, then of course we obviously try to see which domain is affected, and a detailed neuropsychological testing will be done, which might be done by the psychologist in tow, or which is done by us ourselves, and then we see which domain we need to work on. Now, another very important thing is, as far as investigations are concerned, certain blood investigations are done, but An MRI plus minus, usually MRI will only tell us what size of the brain, what part of the brain is affected. So that will be helpful. But in a way, to make a plan, it is not a pharmacological plan which is always made. It is a care plan. So it will be a non-pharmacological part and a pharmacological part. Now the pharmacological part, yes, there are a lot of medicines. Unfortunately, the cabinet of medicines has been pretty dry as far as dementia is concerned for a long time. However, there are new medicines which are sort of in the pipeline. We don't really know when they'll come to India, so let us not get too excited about it. But most medicines tend to at least help us in maintaining a plateau. So I think that is something which is very important. Then if there are behavioral effects in an older person with dementia, we might have to take help of other medicines as well, which will calm them down. So that is there, but we might have to dwell on the non-pharmacological part, which of course I would want Mr. Shailesh Mishra just to comment on that, because the non-pharmacological part should always be initiated when the pharmacological part is done. It should not be that, no, let us give the medicine, see if there is improvement, and then non-pharmacological, because it should be something which should be seen simultaneously. So Mr. Shailesh, if you could just elaborate on the non-pharmacological part.
Sure. So, thank you, Dr. Prem, because most of us don't know how the investigation are done and what is the process. Thank you for telling us that. Before going to the pharmacological, non-pharmacological approach, I want to stress on the prevention part also. First, I think it's important when you get diagnosed with dementia, Alzheimer's, when your doctor says, okay, I don't blame all the doctors. Some of the doctors only write he or she is suffering with some disease, and they write some medicine. They don't tell them where to go, what to do. I think that is a problem. So if somebody writes you are suffering with dementia, Alzheimer's, or the family member, first is to accept it. We should not be in denial. No, my parents ko kuch nahi hoga, because it's a mental illness or it's a stigma attached. Because if we don't identify the problem, how are you going to tackle it? How are you going to talk about a solution? First is accept it. Accept the problem. I or somebody has dementia, Alzheimer's. Then you take help. It also should be remembered. Some of are reversible, but it can't be cured also. There are some dementia it can't be cured, and it can happen to anyone. The person is not mad. And why I'm telling you all this? Because non-pharmacological approach starts from here. The person is not the patient. He or she having some brain problem. They are not able to understand. They are not able to see what is happening there. They are not able to control themselves. So they are not mad, first of all. They are not admitted to any mental hospital, or they are not admitted to any state government mental institute. So that is one thing. They are not doing things purposely. They don't have control. They don't have control on things to do, or whether I'm spreading my food, whether I'm not wearing the dress, whether I'm not applying the soap, I'm not taking bath. It's beyond my control. Check. The last is, it is a full-time work. It's full-time care. There is no shortcut in dementia, Alzheimer's. Many people come, okay, doctor ke paas jana, give me some injection, give me some medicine, keep them in rehab, they will be cured, or no, it doesn't happen that way. I think that is important. Coming to prevention part, we are too late to prevent dementia. Talking about 60 plus, we are too late. And whatever we talk about, 100% prevention can't happen. We can only reduce the risk. I think this is very important. Prevention can be done, or step to be taken when you're 40. Still there's a time. Like doctor said, physical exercise. Many of us don't go for walk. We live a sedentary life. We get up aram se because we are retired, so there is no work. I'll get up at 10 o'clock in the morning. Aisa nahi. We have to get up early. Walking 30 minutes walk is very important. I think that gives you not only free fresh air, it stimulates your brain, it stimulates your visual, it stimulates your ears. You hear, you talk to people, you go around, you breathe fresh oxygen. Then social engagement. Social engagement be also joining a daycare center, joining a senior citizen association, helping somebody, doing some activities, can be any other thing, music and other therapies. Also, then diet. Diet plays very important role in prevention and also to manage dementia. So, having green vegetable, fresh fruits, almonds, These are some of the things where we can tell you in detail in another lecture. But good diet is also very important to take care of your brain and heart. If you have a heart problem, if you have cardiac problem, then there might be chances you get dementia, Alzheimer. So mental stimulation is also important. Just sit at home. What we do, Dr. Prem, we tell the people to challenge the brain. We tell them to break the rules. How you break the rules? Example, I'm just giving an example. It might sound funny for many of you. I'm a righty. I eat with right hand. What I do, I take a spoon and eat with left hand also. So you break that rule to left and right, left and right. You are righty, you write with right hand. Try to write one sentence every day with left hand. I think your brain, right and left, will it will stimulate the brain. Then there's something like I have a special seat in my home where I'll sit and watch television, or where I'll sit and have my dinner. Break the rule tonight. Sit in other place. Challenge your brain. Brain is very lazy. Challenge the brain. Don't sit in that regular place. Break the routine. You have a walkway where you go to bank every day. You go to your temple or church every day. Don't take that road tomorrow. Take a different road. So challenge your brain. The more you challenge the brain, I think it will help you to not only stimulate or also keep your brain active. Other thing is stress management. Many people, Dr. Prem or the family members, they have told us they are doing stress management. They are doing yoga. It's not late. Not only for the person, for the family members also. It can be pranayam, it can be hearing your spiritual mantras. It's very important. It gives you so much energy. It gives you peace. Talk about peace and regular sleep. I think that's also a very important thing. As Dr. Prem said, what are activities? What we do we have a dementia home. We do group activities. Like, I remember my childhood when I used to go in the Bal Mandir. We used to not have nursery, but Bal Mandir. We used to have play in the group. We used to pray in the group. Then we used to have food in the group. So here we have seniors who were not having food at their home. They were not having food for 2-3 days. They were making all nakra like a child. I'll not have roti, I'll not have rice. But sitting in the group, because I am eating, they are copying each other. They have food together. They have changed in 1 week. Family is surprised. We pray together. We sing together. We laugh together. I think group activities, and many times we isolate the person, dementia person. We lock them in the room. We don't allow them to meet. No. They are the person. They are the human being. They should be made inclusive for all the parties, all the ceremonies, involve them. Because then you will stimulate them. You will isolate them and you will make a problem for them. Gardening. Gardening is such a beautiful thing. Smelling, taking fragrance of the flowers. People go and pluck the flowers. It's so important. The color, the green color, the red rose, the yellow, the pink, it stimulates you. They're very small things. But believe me, the people who have come to us have been living with us for 6-7 years in the same scale. They have not gone down. The progress, we can't stop dementia, but we can also slow the process. Also, India, we are very good at music, but at certain age we leave everything. So play music, which was earlier. Like when there was a person called Vijay, he used to like mouth organ or flute. So we used to give him mouth organ and he started playing it. And at Independence Day and Republic Day, they don't remember dementia, but they sing Jana Gana Mana. How they remember? How they remember Vande Mataram? So once you start saying, once you give them chance, they remember. Remember, the brain might forget, but the heart always remember. So we need to give them chance. You have your mother or your sister or somebody, your wife, in dementia. We withdraw them with daily activities. Let them cook. Let them help you in vegetable cleaning. Help them dressing the clothes. If your father is suffering, give them pen, give them some reading, give them authority. Make them feel wanted. I am telling you, you will challenge dementia. This is our experience by doing all these things. Talking about old things, and let them talk. They don't talk. Let them talk. Ask them. Don't tell them that remember me, but tell them what I did you do in your childhood. So what we do, I come there and say, okay, today I saw somebody and I ate vada pav. I'm just giving you an example. Then they will start telling their stories. Tell them what you're feeling, what you're doing. talk about good things and involve them in a lot of activities. It can be watering, it can be talking about pictures, photographs. There are a lot of iPad and phone games available. There are a lot of Sudokus and there are a lot of things we can do to stimulate brain. But don't overdo also. Dementia person has a attention level is 15 minutes, not 10 to 15 minutes. So it doesn't have more than that. So as a person, you don't have dementia, do all these things, give rest to yourself, have good food, sleep well, and I think we can reduce dementia Alzheimer's.
Yeah, just to add on to that, I think it's very important to remember that you are not treating the disease, you are treating the person. So one tends to forget that dementia is the disease, but there is a person who's suffering from dementia. So if one is able to understand that and maintain that in your way of caring for that person, then that obviously sort of changes. What I would also like to emphasize is that care for dementia does not only happen in hospitals. Care for dementia can happen at your own home, but that does not mean that if you're not able to do it at home, there are not places where care for dementia can be done. So, and at the outset only, I would want to tell there should be no amount of guilt where you feel, no, I'm putting my parents away or my father or mother away. Remember, you are trying to put them in a place where they will get better care than as compared to you might be able to give, not because you don't want to give, but because ultimately you're not trained in that. Now, that is one thing. Secondly, another very, very important thing which sort of matters is there are certain behaviors that an adult with dementia might have, which is usually always stopped at home. For example, wandering is there. Where would they wander out? Whereas all these things can be encouraged in an assisted living facility in a good way, wherein you're not stopping them or agitating them, but things can be done. So care is available, but one should understand that the disease itself should be diagnosed at earlier the better, agreed, but it's not, there is nothing known as, it's only, let me tell you very frankly, it's a cliche which has been shown in the movies that we doctors never say it's too late for you to come. What happens is one has to understand that whenever you come, there is a sort of level of treatment or care available, especially in dementia. But the diagnosis part, the responsibility is on you when you're younger, how you have sort of taken care of yourself, whether you have taken care properly also. Now, a lot of people just say that, no, I mean, he did not have any disease, he was having very active lifestyle, but he still got. So yeah, that also can sort of happen, but that doesn't mean that it shoos you away from doing that. So there is a very much proven research proven way of not getting the cognitive issues. Again, but there is no guarantee to say that you will surely not get it. But see, usually when you have good habits and they sort of continue, their health is automatically sort of taken care of. Then I have seen people with Alzheimer's who have not painted in their lives produce beautiful craft. I mean that is crafts and arts and paintings that, I mean, even the great artists would be given a run for their money. So what we're trying to do here is stimulate the parts of the brains which are still active. So it's not necessary. That's what they say. You don't give up in dementia. You try to preserve what you have, but at the same time, the level of care that they might need is something you have to be in sync with your doctor, whether it's a geriatrician or not, and the caregiver who is there, along with maybe an external help which you might need. It could be help at home. It could be help in assisted living. But try to sort of figure that out, and you will not be able to do it yourself. Secondly, educate yourself about the disease. By educate, I mean the denial part is over, then comes the education part into understanding that what happens might be because of the disease. Educate yourself through doctors. Don't entirely rely on Google. Ask the doctor, ask people who might know about reliable sort of spaces online, offline, where you can get information. There are plenty. Then secondly, support groups are very important, especially for the caregiver, wherein you might actually get to know solutions to problems which others have also tackled, and they have tackled in their unique way. And it's all titration. Let me be very frank. If something works one day, it might not work the other day. And finally, one of the very important things is how you communicate with a person with dementia. Communication is very, very important. For example, have a thali of food and having 5 to 6 things in that. They'll get confused. So sometimes you might actually have to just give one thing to eat, and then slowly and steadily they might eat. Sometimes you might have to eat. They might just feel, why am I eating alone? I'm not having a sense of belonging. So you might have to eat with them, and then they might eat. So sometimes you have to see the way you can do things, and it will vary every day. Sometimes it might vary maybe with sort of time also. And another very, very important thing is, do not get aggressive, do not get very angry, because it's the disease which is making them do things. It's not necessarily them. And try to communicate in a very, don't confront. Nahi, aaj to nahi hai Sunday. How are you saying that today is Sunday? That is not going to help you or the person, because they are really not knowing. But at the same time, if you can make the surroundings around them better, then they would obviously have a better chance to sort of understand where they are, rather than what to sort of do. So I think there's a lot of things which can be worked with in cognitive impairment. And again, branding anybody dementia without diagnosis is the worst. And that happens a lot. So I think that's why diagnosis is very important, but it's not enough. Diagnosis and a care plan in which their entire sort of plan can be made for the older adult is very, very important. So I think that's how we should sort of get your knowledge in that way, rather than just believing in things which might just be blindly put online.
Based on that leads to my next question of, is there early tests that you can do? How soon can somebody test? Is it something that we take regularly for dementia? What are the basics that somebody has to follow, like diabetes or something? Can I go get myself tested to see if I have dementia? What age
so basically, I would say ultimately, always there's a health checkup which should be done yearly, according to me. Because corporates are involved, even younger people are getting that done yearly. But once you cross 50, you should have at least an yearly health checkup, and you're showing your doctor to see if things are okay. Now, even the memory screening ideally should start at this particular age. If you already have risk factors, you might actually have to start it a bit early. 50s is a good time to get yourself tested, at least for basic memory testing. 60 is, of course, the official age group. We know that we are only getting older. By that, I mean health is getting improving. So the upper limit is more. More and more people are centenarians now. And we know that more and more people will sort of live longer. Now, another very important thing is tests doesn't mean blanket testing. Now you're having sort of memory loss. You do all the blood tests. You are like, mujhe sab karna hai. I have to do everything. You do the blood test. You do an MRI. You do a PET and everything on your own. And then you realize something comes somewhere and you're like, oh my God, I didn't expect that. So I think that should not be done. Whatever test should be done, it should be done. Whether it's your physician, whether it's your geriatrician, first consult and then try to get those tests done. Now, it's the system in India where you can do it if you want to, but if you really see abroad, you can't get anything done without actually having a proper prescription. In India also, to a great extent, you can't, but we still sort of tend to just say that because I am failing memory, so I have the ability to sort of go why the test should not be done. Again, when you do those yearly tests, we get an idea, but when you get specific symptoms, do not just neglect them. I think that is another sort of, when there are red flags for yourself, you might not realize. The relatives are the ones who might actually start realizing, nahi bhool rahe thoda, there is some forgetfulness, he's keeping the keys somewhere else. And as you go later and later, decisions have to be taken, especially for driving, because what happens is there can be an issue with sort of directions. There have been cases wherein a person with dementia has continued to drive because they were normal, but they didn't get tested for a while, and then there was an accident as well. So then it becomes legality, that becomes an issue. Then another thing which we have faced is, unfortunately, sometimes what happens, two sets of, these are all family things which might happen. 2 sets of tests might be there. One says he has got dementia, one says he does not have dementia. So then, of course, we need to do an independent sort of assessment ourselves and see. So I think this is what early would be 50s. Taking care of your health has no upper limit. That has to start much, much earlier, because you don't age at 60. You start aging very much the day you are born. So it's 1 year old, 2 year old, 3 year old, 4 year old. So you get aging, and depending upon what and how your 30s, 40s have been, that's how you sort of age. So we need to be working on it much earlier, but I cannot tell you when you're 60, you should have worked earlier. No, you can still work because people are living up to 100. So it's not as if people are only going to live till 65, 70, 80. So I think that's the way we should sort of look at it. But just don't do random testing. Please do it. Discuss it with your doctor and then try to get, if specifically if they refer you to a geriatrician or maybe a psychiatrist or maybe a neurologist, and then try to do the testing. Yeah, Mr. Mishra. Yeah.
Yeah, so very nice, doctor. You have mentioned right things here about diagnosis and things to do and not to. I want to go ahead with some basic tips, a commandment to take care of dementia, Alzheimer, do's and don'ts. I think that because when we talk to person dementia, family is involved, the caregivers are involved. Because in India, we are not trained, first of all, how to grow old. We have been trained how to be a good child, how to be a good parent, how to grow old is not taught to us. And dementia care is, forget it. Nobody will tell you. But still, there are a lot of awareness, a lot of things are happening, and things are happening in your own language. So we have learned some commandment. I think I call them 10 commandments of dementia care. I will just go through it. I think very small thing, but very important when you're working with dementia person. Whether he or she is a family member or your professional caregiver. Remember, first of all, as doctor said, you have to share your responsibility. You are not Shivaji or Superman or Superwoman that I will do everything, Jhansi Ka Rani. So you have to share your responsibility with the family member. You have to sit and decide what needs to be done. If the family is not there, we believe that in metropolitan city, you take a help, external help of caregiver. There are bureaus available, there are association available, there are daycare, there are dementia centers. Take their help. That is also important. Then only you will able to give them good life, good dignified life. One of the most important things when you talk to dementia person, keep an eye contact. I think that is the most important thing. When I'm talking to dementia person, I'm doing some other work and speaking to the person. No, they will not understand. They will not comprehend. They will not take your talk or understand things if you don't have eye contact. Eye contact is very important. Then talking to them at what level, what kind of height. You should be at their eye level. You should not stand and talk to them. Do this, do that, nothing. Or have food, no. Sit with them at that eye level and then talk to them. I think they will understand. Then speak slow. Don't speak one thing, one task at a time. Keep it simple. Example, let's have food. And you should not say like this, let's have food, then keep your plate there, clean it, and then go and wash yourself. No, let's have food. Food ho gaya, then let's keep this plate in the sink. That's done, then let's do a brushing. One task at a time. Keep it simple, talk slowly, don't, give too much orders or too much things to let them to do. And don't correct them. If they are saying today is Sunday, today is Sunday. Today is night, today is night. Don't correct them because they will feel off because they are older people. They don't control them, but they know they are old. They are their mom, their dad, your husband, your wife. They are something. They have lived their life, but they are not able to tell you. So if you correct them, they feel offended. Agree to them. Catch what goes. If there's a night, if there's an afternoon, nothing goes. So don't correct them. Don't argue with them. Instead, agree. Okay, today is Sunday. Tomorrow we'll go out. Tomorrow is Monday. So don't argue. If you argue with them, then there's a problem. Because why I'm telling you this? Because this will, increase their aggression. This will also help to progress the disease faster. It will progress faster. If you do all these things, if you take proper care, if we can slow the disease. Don't raise your voice. Don't shout at them. Talk slowly at the voice that they love. And not tone can be different. Do this thing. Aisa nahi. Can you do this thing? Tell them, ask them questions. Can you do this thing? There's a way to talk. The tone is important. Don't raise the voice. Don't tell them, do you remember me? I met you they will be confused because they can't remember. Tell them, I am Sailesh. I live in your neighborhood. I am your son. So I have come to meet you. Introduce yourself. Talk to them this way. Don't tell them negative things. Many times they have questions like his father has died, his mother has died, his wife has died, and husband. Should we tell them? Of course, it's an ethical question. But we found at our center, it doesn't make difference to them. But sometimes, at some sense, they are not always blank. Just remember, they are not always blank. At some time, they're at that particular moment. And if you tell them the negative news or negative part of it, they will feel, depressed, and there will be a lot of, mood swings can happen. And never say no to them. Instead, divert the attention. I want to go out. They always want to go out somewhere. I want to have food. So divert the attention. Okay, you want to have your food? Okay, now it is 12 o'clock. I'll give you food at 3 o'clock. Then he will ask again, I want to have food. Okay, we'll have at 3. Repeat don't change your answer. The answer should be same. So slowly they will stop. Like we have people who want to have medicine. Every family they want to have medicine. I can't keep on giving medicine. Doctor said food. They will get hungry so many times. They will feel, okay, I have not eaten, give me food. So you can't give full plate to them every time. They will spoil their stomach. So what we do, if you have 4 chapatis, we give 1 chapati, small rice, small dal. Let them have 5 times. It doesn't spoil their, then we have to work on that. I think this is also important. And let me also go ahead and tell you is, we get a lot of complaint of missing senior citizens. I think this is the biggest challenge in India. Like we don't have system, we don't have proper infrastructure where we can find people who go missing. Dementia programmer people often tend to go away from home at the early morning, especially when the milk wala come, when the newspaper come, they tend to walk out. So there's a lot of chances of getting missing. So what we can do is also keep an identification with them. It can be, now there are smart watches, there are devices which can be given to them, bracelet. We can give them the identification mark, ID card, and other things that will help them to people who are missed. And people who, if you found somebody is missing, don't panic. First, go to the police station and write a complaint, because there's a system of police, they will find their own self. But again, also see that, inform the family, go out, tell your watchman, tell your building people and your neighbor that father, mother, or somebody suffering with Alzheimer's, they have a memory problem. Don't be ashamed, because telling truth will help you to help your person. If you hide, watchman will not know. No? Like we tell the watchman, just see my child doesn't go out. The watchman will be very strict when the child go out. He will stop the child not going out. But if you tell the watchman, my dad is having memory problem, unko jara dhyan dena. Let's take care of him. He will see that he doesn't go out of the building. So these are something we don't have to tell. Like also, don't be so rigid. Like 8 o'clock breakfast, 12 o'clock, bath, then sleep, then do this, do that. No. Many times, today is raining. I was not feeling taking bath because it's so cold here. I don't want to go out. So it's my wish. So the dementia person is a person first. He is not a patient, first of all, remember. So you have to honor. If he's taking first or not having bath, so we can change the topic. Example, today your sister is coming. Today some guest is coming. Today we have to visit Ganpati Bappa. Let's take a bath. So, you have to create stories. You have to be good storyteller. You have to be happy go person to take care of them. Remember again, remove all the sharp edges from your house. It can be glass, it can be a table where they can hurt themselves, because they are not aware. They are walking, they are wandering in the house. They are not at home. There are spoon, there are knife, there are scissors all over. Just take care. They don't hurt themselves. And when you renovate your home, this mistake we have seen a lot of times. What we do is change the bed, we change the sofa set, we change the color, we change the curtains. They will confuse themselves. So do one at a time. Don't to change everything. So they will confuse. And Dr. Pei, we got so many people, families who love their parents. They have 3-4 siblings, 3-4 children. So what they will do, they will treat their father and mother of the person as a baggage. 2 months he will stay with, 2 months he will stay with the B, 2 months. Change of place is the biggest problem in dementia Alzheimer's. It will progress the disease, it will create confusion, it will create disorientation, mood swings, and the person will be uncontrollable. They are not baggage, they are parents. Just believe when you are there, you will be shifted from one home to other home. It doesn't happen that way. So see that they are not shifted in different homes. Keep them in one home. Take help from some people. Yeah.
Thank you so much. We're running out of time, so quickly I'll catch up with a couple of other questions that have come up. Mr. Nagaraj, I see you have raised your hand. Do you have a question for us, sir?
My name is Nagaraj Rao. I'm 84. I understand that the tendency of AAADS, that is Age Activated Attention Deficit Syndrome, is a stepping stone for dementia. Am I right?
Doctor.
Am I clear, or should I repeat?
Yeah. Dr.
Yeah, can you please repeat? I didn't get the entire thing.
Okay, it's called AAADS, that is Age Activated Attention Deficit Syndrome. In Kannada, it's called Arulo Marulo. Is it a stepping stone for dementia?
Oh yeah, I mean, okay, fine. We always keep talking about the short form, so we are more. So ADHD is what you're talking about. So yeah, I mean, if I have to say, usually it is actually a disease of pretty much the young. I mean, it's diagnosed when maybe around 3 to 7 years of age, and as you obviously, it can be maybe diagnosed later in even childhood. The fact that usually suddenly nobody is going to sort of get it as you get older, but it is not really been seen that it will definitely cause Alzheimer's or it will definitely cause dementia. So there is no real research saying that no, definitely if somebody has ADHD, they will have sort of dementia. However, if you obviously, I mean, there is a genetic syndrome which is known as Down syndrome, which a lot of people do know about. It has been seen that Down syndrome people might have dementia much earlier, because in general also they do not live longer, so they might actually have dementia maybe as early as even in their 50s. But it's not necessary that a person with ADHD will definitely get dementia or it's a predilection to dementia, because it's a disease very much of childhood. I mean, and it's diagnosed also very early in childhood or maybe just a bit later. So there is no real necessitating into it that it will definitely cause dementia.
We have another.
I think Mr. Sai Prasad Rao wants to ask a question. Right?
Yeah. Good evening. I'm Sai Prasad. I wanted via Vikas or through you to let us know in Bangalore who are the geriatric doctors whom we could consult for problems like what we have discussed all this while.
Yeah, I think I'm sure definitely via Vikas would be able to help, because there is obviously been.
Mr. Sai Prasad, they raised your hand.
Want to know about geriatric doctors in Bangalore? I think they should get in touch with you. You can help them with that. I'm sure about it.
Okay.
Thank you.
And there are a couple of other questions if I can just go ahead. One is, of course, is dementia hereditary disease?
Yes, sir.
Yes, to an extent, yes, but not necessarily the entire gamut of it. It's a very low percentage. It's not a very high percentage of people definitely who somebody has in family will get, but it's a risk factor. If somebody has dementia in the family in the past, then there is a risk factor. You might still have it. It's not necessary that you will have it. Then can a person with dementia feel pain? Absolutely they do. There is no doubt about it that they don't. The way they respond to it is different. So I'll give you a very simple example. A person with dementia having constipation, they will start grunting, they will start getting irritated, they will start getting restless because they have not got maybe 2 days, 3 days, they have not gone for stools. So that pain is actually developing. Maybe they might have bone pain, they might actually get hit. You are not realizing that they have been hit. There is a breakage of the bone, but they get really irritable, they get really angry. So yes, they definitely understand pain. They don't understand the fact that they're having it, but they definitely are in pain. It is our challenge as clinicians and even paraclinical staff, even people who take care of people in assisted living, especially nurses, caregivers, attendants, to understand that that is not the disease only. There will be, see, whenever, I mean, just the bottom line is, whenever an older adult with dementia, there is a change in behavior, do not only brand it to the disease. There is to be an instigator. Whether it could be pain, it could be constipation, it could be infection, it could be an electrolyte problem, it could be change of place, as Mr. Shailesh said. Just one day they have been shifted from home to the place. It's a challenge. And I still know a lot of my patients, change of home, the children still take that particular person with dementia to the old home every day, at least for half an hour, saying, Abhi, there is painting going on. So you need to be your story sometimes. But painting is going on, but it will not be safe. So they go there, they stay for around 1 hour, and then they come back. But sometimes in the night, they might have, no, I want to go immediately. So as Mr. Mishra also said, to tackle that is not aggressively. To tackle that is very tactfully with a story, in the sense that, no, but it is too late. And it is, how will you be able to go now? We will go tomorrow, no problem. And then maybe they won't even remember the next day that they have to go. But if they still insist, you take them in particular good amount of time where they actually understand that they've seen the house. So I think those things matter a lot. So they feel pain, they feel everything. Let us be very, very frank. There is a human being behind the disease, so they feel everything. But it is our challenge to understand how they are feeling and to detect it. I think that is where the challenge comes.
Yes, Mr. Mishra.
So you're on mute.
You're on mute, sir.
I want to stress about caregivers, the family members. I think when we talk about dementia, Alzheimer's, they are equal partners. We call them care partners, the family members who are taking care of the dementia person. We can't forget them, because without them, we can't handle the person. The caregiver have multi-dimensional impact. Their life is broken. Like they leave their job and they have to take care of a person. They don't have income. Families are not there. The relatives are not there. So they face psychological problem. They face emotional problem. They have social disconnect. They have physical distress, and they have financial problem. We should remember the caregiver. We should not forget them. So we need to help them, help the caregiver. And doctors said there are support groups who are available. There are so many family members that are sharing their stories, how to take care, how they have helped themselves. So, like some people started yoga practicing, some people started spiritual thing, which helps them. Then they have emotional and psychological problems, so they can take help of the psychologist or psychiatrist, or give themselves a break. Take the help of the volunteer, other family members, or a friend who can work for some time at home, cooking on the cook. Then you can go out, have a coffee. So we should not forget that, because caregiver, if the caregiver is stressed, then they will start abusing. Knowingly or unknowingly, they will not provide right care to the person. I think caregiver is also very important. And other important thing is involve children. Don't leave the children out of the care plan. Children, pet, and the greens, gardening. I think 3 important things for human habitat. Intergenerational thing, pet, a lot of pet. We saw seniors in dementia home, they love children. Whenever there is a child, we all love the child. They want to play with the doll. We give them the doll. We have got dolls from Singapore, Dr. Prem. It's such a lovely. They want to give them the bath. They want to make them the dress. They remember something. The children stimulate them. Dogs and cats and other pets, if you like them, they stimulate. And the green, the garden. So involve, make the care plan inclusive. The dementia person, the family members, the pet, the green, the children, everybody is involved. And last, not the least, Dr. Prem, if you will agree, get a lot of people who are suffering with dementia and they are admitted to hospital. For some reason, it might be kidney, it can be dental problem, it is eyesight problem. And the doctor is not told, the surgeon is not told the person is suffering with dementia. So what happens here? So they try to take the response for the person, the nurse, they say not aware. Anesthesia is not told. So there is a problem. So when you admit a person for dementia in any hospital for any other illness, any other problem, involve the psychiatrist or neurologist or person who's taking care of the dementia with the team. because then only right treatment can be given, because more anesthesia can be a problem. Doctor is not told, he might give some certain medicine which will create problem for him. So involve your medical professional with the team who is taking care of the dementia. This is, I think we face a lot of challenge when you have to extract the tooth. Old age, you have eyesight problem, tooth, hearing problem. So involve your doctor who is taking care of the person. I think things will be much better.
Yeah, just to add to it, there are certain things which affect quality of life, and quality of life doesn't change in a person with dementia as well. So if the person has a hearing problem, correct it. If the person has a vision problem, correct it. You have to improve their quality of life. That will also help you in tackling them, of course. And the caregiver is, I think, the most important person, along with the person who is suffering from dementia in dementia care, because if you don't take care of the caregiver, it's unfortunately an impending abuse, which might happen not necessarily because they want to do it, but because it's too much for them to take. That is where we say that there are organizations which are helpful. Please contact them. Make sure if you don't have family members helping you, there are people. Lot of volunteers are also there. I'm telling you, humanity is not lost. Lot of people do a very good work, and people are ready to give that extra time for doing good work for people with dementia as well. Then intergenerational, just I have to tell, there was a recent case study also abroad wherein they saw people with dementia and they were mixed with almost babies who were in the maybe around 1 year old or just 8 to 9 months. And the way they responded was just brilliant. I mean, they were so happy. We could see there was no behavioral abnormality whatsoever. They were just behaving as if everything was sort of normal. So I think that is also something which should be encouraged. Another thing is, whenever you decide you are not able to take care of them and you want to shift them anywhere, whether it's an assisted living, please make sure that you have a good thought process of shifting. We cannot just sort of shift them from one place to another, and that will be too sudden. That will not be good for them also, and it will not be good for you also. And then finally, I think the most important thing you need to understand is diagnosis is very, very important. But at the same time, seeking help with that diagnosis is even more important. So together with more knowledge, and we should actually help in taking care of those who forget. But at the same time, make sure that whatever years are there, the quality of life of theirs is maintained, which is always taken care by the geriatrician and the team which is involved. And in hospital, I am agree, people with dementia are not the best people to be admitted in hospital. However, things which can be treated should be treated, and they should be discharged at the first particular moment. And that's what I usually do, because I know it's not the best place. Imagine a dementia patient in an ICU. If it is not a serious issue and in an ICU, then they could be in big trouble. All lights, only masks, and it becomes very difficult. And just last but not the least, the rise in dementia has only increased in the last 2 years, and we don't know the burden of COVID and isolation. That is something which we will see in future. This is not something which I am trying to say as a threat, but I am trying to say as a caution. That's why the more and more social activity increases, I think we will be able to sort of help each other. So I think that the bottom line is, do not think that it is an incurable disease. It is a careable disease. So please try to diagnose and take care of it, and make sure that you are able to do a difference in whatever way. And I think that is very important. And as a caregiver, if you are taking care, please be do not be very hard on yourself that, no, I was not able to take care, I should have done better. No, that's not the way. You had your limit. So there should be no guilt, but seek help so that you don't break down. Take care of your own health, take care of your mental health. There should be a day in the time where you're not thinking about that person with dementia. You are only thinking about yourself. It could be 1 hour, 2 hours, 6 hours, whatever it is, but it should be yours. And as Mr. Mishra said, there are a lot of caregivers who might actually be even doing everything. They are the ones who are the financial owner. They are the ones who are managing others, and they are also the ones who are managing the person with dementia. But I have seen such people actually do very well also, because they get so organized and they seek help. But there is always help, whether it's family or whether it's somebody who's trying to, because you can't do everything at the same time. So getting that, I would say the word is an ecosystem. You manage a person with dementia with a very robust ecosystem, and that ecosystem involves everybody. It can involve an attendant, nurse, caregiver. It obviously involves the geriatrician, the doctor, and it involves different ways. A person with dementia, worsening dementia, might have to go from the home milieu into the hospital, not necessarily stay there for long, and ultimately might have to go into assisted living. But ultimately there is care available at every stage. So please don't think that no, it's sort of a death knell. No, somebody with dementia, no, it is not a death knell. So more you understand about it, more spread the word also. That is what I would want to say, because ultimately we tend to understand, but we do not tend to spread the word. So more the knowledge gets, spread it, and that will also help in the longer picture.
Thank you, Dr. I think that was a closing statement from both of you. And awareness is very important. I hope people attending today got a bit of knowledge about dementia and the awareness of dementia. With this, I would like to thank both of you for participating and taking part in a very great informative session. We will be closing now. If anybody has questions or if you have anything more that you think about, please WhatsApp us or email us, and we will get back to them. Come and ask you. Yes, Dr. Mishra. Yes, Mr. Mishra, go ahead.
Thank you, Dr. Narasimhan and Mr. Sailesh.
Last, I just want to end. Last thing before we end is to take care of legal papers of of dementia person. So make when you're old, when you're 60 plus, I request everybody to make a will, have a power of attorney, check your bank account. Is there a nomination in bank or housing society, because that's going to help you in dementia person. Thank you all of you. Dementia, we can work together, we can fight together. It's not worrisome. We have overcome cancer, HIV, diabetes, and blood pressure. Dementia also we will overcome. Only we are united, we fight together, all the family members, all the association, everybody is there. Thank you so much.
Thank you so much for that. Like I said, if you have any questions or anything, please ask us and we'll always come back to answer to you. We also have a few more sessions lined up over the next few weeks. Please do join us in those. And again, on behalf of Vaya Vikas, I would like to thank both of you for being a part of the session today, and for all the participants who came and asked questions and made it a very informative session. Thank you so much for being here today. Good evening to all of you. Bye.